It is likely that there were people who didn't even know about the Army Medical Research and Development Command or its capabilities before this year. But very early in the nation's fight against COVID-19, the name of MRDC and its role as an asset in that fight became a common topic of conversation in the media, in the halls of Congress, and wherever the battle against this novel coronavirus was being joined.
Through both emerging science and technological advances, the United States Army Medical Research and Development Command is on the forefront of delivering medical capabilities faster and more efficiently than ever before. We are supporting a whole-of-government approach to detect, prevent, and treat COVID-19. And when it comes to infectious disease threats, we have extensive capabilities and an international research infrastructure already in place that allows our scientists to anticipate and develop countermeasures against emerging infectious diseases.
The capabilities of MRDC that were available to aid in the fight to detect, prevent, and treat COVID-19 included researchers in infectious disease, who are the most obvious people to call upon, but who are only the tip of the iceberg.
We're very unique in the DoD that we have scientists, clinicians, regulatory teams, and our project managers that can take an idea all the way to the field and we'll test it along the way to get it there. So I really think that's our secret sauce. I think that helps us. We work together from start to finish to make sure that we're just not throwing something in what we call the valley of death. We're handing it off to our partner nicely. And so I think that's what works for us.
Still, the research labs at the Walter Reed Army Institute of Research and the U.S. Army Medical Research Institute of Infectious Diseases were some of the first parts of MRDC to pivot to dealing with the disease. Rare began working on a vaccine immediately.
My department and our primary laboratory, under the direction of Gordon Joyce, we were working on MERS-CoV, which is Middle East Respiratory Syndrome coronavirus, another deadly coronavirus that is of concern to the Army and the entire military, given where it occurs and how deadly it is. When COVID-19 hit, we were able to take the experience and the resources that we were focused on MERS over to SARS-CoV-2. And we did that the first day that the sequences were published of this new virus.
At USAMRIID, work began on propagating and characterizing the virus to assist researchers by better defining the enemy they faced.
Know the enemy, characterize it well, make sure you understand as much as you can about it before you go into battle. Every virus, all it is genetic material encapsulated in a protein. And every time that virus makes a copy of itself, it actually has errors. And it shoots out different viruses. So we had to characterize the virus to say the virus we're using is what is running through the population right now. So it was really important to make sure, because if we develop any sort of treatment, a vaccine or a monoclonal antibody or anything, we wanted to make sure it was actually going to work against the virus that was circulating, not some artifact of what we've developed in the lab.
As prevention efforts ramped up, both Rare and RID labs began working on diagnostics to increase and improve testing for the disease.
So one of the strengths of Rare is that we, and particularly for HIV and sexually transmitted infections over the last 30 years or more, have provided and partnered with industry to make sure that there were available diagnostics for our service members and then subsequently also for the civilian sector in the U.S. population. So I would say that as many of my colleagues here at Rare, we got very busy around the first week of February and have been incredibly busy ever since. So.
Of course, soon after COVID began spreading, it became obvious that the nation lacked some of the important materials it would need to even conduct all the tests that might be needed, not to mention personal protective equipment. MRDC could help there too.
So I got a phone call from the senior clinical advisor at MRDC, and she said, hey, I have a really neat idea for you. There's all these people that want to help out, but they don't have the expertise to know how to take a design through the FDA and get it out to the warfighter. So she said, hey, can you assemble a team who can help everyone across the DoD, Army, Navy, Air Force, Marines, you name it, to get them through the FDA process so that we can help out with all the supply shortages that we're having. And I said, all right, I'm game.
Meanwhile, teams at RARE, RID, and elsewhere in the command were searching for treatments for the disease. In the Warfighter Protection Acute Care Project Management Office, one partner with whom they were working already had something that could help those suffering most from the disease.
What's really great about this is it was a company that we were already working with on using the same drug, this therapeutic, but we were actually developing it for a completely different indication. It's a drug that is designed to be a broad spectrum snake bite antidote. It's the same company, it's the same drug, but it's a drug being used for and evaluated for a completely different indication, which I think is it's a really interesting story that, you know, it's not something that's brand new. We didn't have to create a new molecule. We didn't have to start from scratch. Just being very creative and working with a partner that's very creative about what these chemicals can do.
The U.S. Army Medical Material Development Activity also had a partner with a treatment in the works, and they were able to quickly make an agreement to get the drug in the hands of providers to treat soldiers.
We've learned the logistics part and how quickly we can ship and resupply and what the best methods of shipping, and we're using a hub and spoke. So we will have, in the U.S., we're the hub here, and we can ship anywhere overnight. So say they have 50 patients overnight at Brooke Army Medical Center at Fort Sam. They just let us know, and we have a 24/7 phone, and we immediately reship, or we activate a treatment protocol depending on what option they're using.
The Telemedicine and Advanced Technology Research Center also stepped in to provide assistance with treatment by creating a system to aid providers who were treating patients in areas with little to no critical care expertise or infrastructure.
This is especially important in rural parts of America, where even if you do have an ICU, you may have a fairly limited number of skilled providers. And where you have limited numbers of skilled providers, they may get sick from the actual disease. And if they get sick, then now you have, again, a gap. And when we deliver technology solutions, and the most important ones that we have started with is to create a digital health ecosystem around the use case of telecritical care. And telecritical care is delivering critical care services using communication solutions from anywhere to anywhere.
MRDC is committed to protecting the health of the warfighter through the research, development, and acquisition of health solutions. Pivoting to the fight against COVID-19 wasn't just another way to serve, but it was a proof of concept of MRDC's way of doing business.
MRDC is the perfect place to be to respond. We have so many different subject matter experts that have in-depth knowledge of regulatory processes, manufacturing processes. We have clinical experts, we have agreement experts. We have people who can assess a product and tell you how to get to yes.
I mean, this is what we do. This is our mission. Obviously, we work in a different space than, you know, working on a pandemic. We don't typically work, you know, kind of under those kinds of constraints. But in terms of the work that we're doing, developing pharmaceutical or medical solutions, it fits right in.
We have a breadth and depth of knowledge and experience across this command that is really unparalleled. We have obviously expertise in infectious disease. We have expertise in technology development. We have expertise in casualty care. We have expertise in delivering services in remote and austere locations. And we have the infrastructure, the support structure to make sure that we are able to not only develop those solutions, but transition those solutions to actual deployments and get them through the FDA regulatory pathways in order to actually make them useful to the American public and to the soldier.